In the early 1990s, the Department of Mental Health saw a need for a non-traditional organization dedicated to providing treatment and support to adults with the most serious and persistent mental illnesses. These individuals were requiring a community outreach model of not only medication, but 24-hour support. The 9-to-5 clinic model that was prevalent in the Nashville community was not addressing the needs of this population, and these individuals were falling through the cracks in the traditional mental health system. In 1993, that changed with the founding of MHC, a nationally recognized organization offering mental health treatment and support services in one integrated, seamless system. Committed to the belief that there is life after diagnosis, MHC adheres to the principles of rehabilitation and recovery.
We're different than mental health agencies because, first of all, we serve only the seriously mentally ill adult, and we serve only children with serious emotional disturbances.
Involving family members and friends, MHC works in such a way to allow individuals to live and recover in their own environments with as little professional intervention as possible.
All of us have been through some type of catastrophe in our lives. We think about all the goals that you had prior to being diagnosed. Just because you're diagnosed with a mental illness doesn't mean that you become that illness.
MHC helps individuals learn and grow in their living, working, and social environments so that they may learn to live productively outside of the formal mental health system, focusing on recovery from the consequences of the mental illness instead of on the mental illness itself. The core service of MHC is case management, working with teams created to address specific illnesses and needs. MHC keeps the focus on the consumer, placing them in the center of support circles made up of family members and friends who work along with the team.
We're unique in that we treat consumers through a team approach that has case managers, a psychiatrist, and a nurse on a multidisciplinary team.
Treatment teams are medically directed by a psychiatrist or advanced practice nurse in concert with registered nurses.
The team works together to help educate the person about their illness, talk about their medications. Is it working? How well is it working? Symptom management, are there coping skills that you can learn to do to help you manage that symptom? And then rehabilitation, what else do you want to do in life? What about those goals that you always had before you were diagnosed with a mental illness?
Another facet of core support is crisis services. MHC offers a mobile crisis unit as well as a 24/7 walk-in clinic.
Our goal is to help that consumer resolve their crisis and stay in their own environment and not be admitted to inpatient facility.
A Crisis Resolution Center, CRC, an Intensive Intervention Center, IIC, and psychiatric office services round out the full slate of crisis support.
We're looking forward to the opening of a crisis stabilization unit that we've just been awarded through the Department of Mental Health, which will also round out our continuum of crisis care. A person can be admitted to that unit who otherwise would be going to the hospital.
In support of the core case management, MHC is equipped with a pharmacy to help with consumers' daily medications.
We have an on-site pharmacy that assists consumers in learning about their medication and getting their medication in individual dosing.
One of the things that the pharmacy does is create bubble packs for people who may need that. For some people, having a whole bottle of medications is too much. So if you have a bubble pack, which tells you the day of the week and your medication for the morning, for the evening, whatever time of day, it's right there in a bubble. All you have to do is punch it out.
A representative payee program is in place to assist consumers with budgeting and allocation of their monies.
With this program, we actually set up a budget for them. We pay their bills. We make sure their rent is paid, their utilities are paid, and then we set them up on an allowance system. This is a program that we work with Social Security. We are an organized payee for these individuals.
By having a representative payee service, we can help them stretch their dollars through the month, and actually, if they want to save towards something, help them do that.
Transportation is provided when consumers need assistance with their day-to-day activities, and MHC often helps with daily housing needs.
A lot of our people are not able to just get on any transportation, go on the bus and get somewhere. So we have transportation people who are trained. That person needs extra time getting out of their house. They need to help them into the van. Our staff are trained to be able to do that. A lot of the people that we serve would need housing. We have housing specialists that will work with that person, will work with the case manager to find the best housing.
Committed to their motto, there is life after diagnosis, MHC's professionals work as a team to be 100% responsible and accountable to the consumers, their families, as well as to each other. Over the years, MHC has become a symbol of hope to the disadvantaged and overlooked members of our society. Not only caregivers, the people at MHC become friends and family to those entering their doors looking for help. Giving hope when it seems there is none, MHC truly lives up to its motto, there is life after diagnosis.